Good day, everyone. We are Group 1, and together with my groupmates, we will be presenting a role play on our chosen case about the parturient woman. So sit tight and we shall begin this instant. St. RV Hospital is a medical institution dedicated to providing quality patient care with unrelenting attention to clinical excellence, patient safety, and unparalleled passion to assure the very best healthcare for those in need. On July 2, 2021 at 12 p.m., a parturient woman, Mrs. May Leonin, has arrived by wheelchair to the emergency room, escorted by her husband, Mr. J.C. Leonin. Upon seeing this, the emergency room nurse, Miss Paula, immediately rushed to the patient's side and assisted her.
Nurse, good morning. Pa-assist naman yung wife ko. Humihilab na po yung tiyan niya.
Okay, sir. Mrs., kalma lang po tayo ha. Ako po si Nurse Paula and may ilan lang po ako itatanong sa inyo para po sa admission niyo. Okay po. Ano pong pangalan niyo, Mrs.?
May Leonin po.
Okay po, Mrs. Milianin. Ilang taon na po kayo?
23 po.
23 years old. Today is July 2, 2021, 12 o'clock p.m. Okay, via wheelchair. Okay po ma'am, check ko po muna ang vital signs niyo and CBD. Sir, pa-assist po muna si Mrs. Paupo po dito. Okay, the blood pressure is 100/60.
Okay po.
The temperature is 37.1. The pulse rate is 90 beats per minute. The respiratory rate is 20 breaths per minute. And the initial fetal heart rate is 140 beats per minute. Ma'am, ask ko lang po kung kailan ang huling unang patak ng regla nito.
October 2, 2020.
Okay po, October 2, 2020. Then, ang AOG niyo po ay 39 weeks. And the EBD is July 9, 2021. Tanong ko lang din po kung pang ilang pagbubuntis niyo na po ito.
Isa po.
Okay po, sabi the one para zero. Meron po ba kayong allergy sa gamot or sa pagkain?
Wala naman po.
Okay po, wala po. Okay ma'am, we will just conduct some tests to make sure you and your baby are safe. The reason for admission po is for labor. Ngayon naman po, bibigyan ko po kayo ng IV fluid for hydration, IVF B5 LLS. Now ma'am, for further assessment po, here is Nurse Amy to assist you to the labor room. Nurse Amy. On ER, Mrs. Leonin, 23 years old. She was admitted today for active phase of the first stage labor. I have just made an initial assessment. The vital signs are 100/60, temperature 37.1 degrees Celsius, pulse rate 90 beats per minute, respiratory rate 20 breaths per minute, and for the initial fetal heart rate 140 beats per minute. The woman is gravida 1 para 0, 39 weeks of gestation. A vaginal exam reveals her cervix is 80% and 5 centimeter dilated. Her membranes ruptured spontaneously 4 hours ago at home. An IV is started for hydration and vascular access. Mrs. Leonin needs to be transferred to the delivery suite.
After the assessment, Mrs. Leonin was transferred to Nurse Amy's care, the labor room nurse, and was taken to the labor room, where she will be monitored for the next few hours until the delivery of her baby.
So you are patient May Leonin. The current date is July 2, 2021. The admit date is July 2, 2021. The time is 1 p.m. The admitted time is 12 p.m. Ma'am, may I know po what is your blood type?
Negative O po.
Okay. Your expected date of delivery po is July 9, 2021. So tama po ba ang huling patak ng mens nyo po ay October 2, 2020?
Yes po.
So your membranes are already ruptured. Ma'am, check lang po natin vital signs nyo. The temperature is 37.1. The pulse is 90 beats per minute. The respiration is 20 breaths per minute. For the oxygen saturation, 95%. And your blood pressure po, ma'am, is 100/60. So proceed naman po tayo sa maternal assessment. Dito po natin malalaman yung response at progress ng labor. So, deep tendon reflexes po, ang result po natin is +1 sluggish. For the vaginal bleeding po, meron po tayong normal show. Sa nakikita ko po, ang pain nyo po is nasa 8 na. And for the edema po, nakikita po natin siya sa inyong lower leg. And for the uterine activity, frequency po natin is 3 to 5. The duration is 45 to 60 seconds. The intensity is moderate to strong. And sa fetal assessment naman po tayo. Ang monitor mode po natin is auscultation, ma'am. And magpapalpate lang po natin yung fetal heart ni baby. Magpa-perform po tayong Leopold's maneuver for fetal presentation, position, and lie. And ang baseline po natin, ma'am, is 120. And for the intake and output, the IV is D5-LRS. Next is, proceed naman po tayo sa physician's order form. The patient is Mrs. May Leonin. The age is 23. Hospital record number is 092658. And the date is July 2, 2021. The time is 2 p.m. So sa progress note po natin, ma'am, nasa 7 cm cervical dilation na po tayo. And physician's order, admit to LR, carried. Hook to CTG, endorse. Insert IV of D5-LRS, 1 liter for 12 hours, carried and endorsed. Pitocin every 20 minutes until contractions are 2 to 3 minutes, administered and endorsed. Ambulate, endorsed. NPO, carried and endorsed. So, sa focus charting naman po tayo. Ang date is July 2, 2021, 3 p.m. Focus is uterine contractions. For data, action, and response, ang data po natin ay sumasakit na po ang tiyan ko. And for the action, administered pitocin as per doctor's order. Then the next is time, 3:30 p.m. Focus is uterine contraction. And the response is uterine contractions increases. So next, endorsing patient May Leonin at the active phase of the first stage of labor under Dr. Borja, July 2, 2021 at labor room. Shift is from 3 p.m. to 11 p.m. with IVF D5-LRS 1 liter for 12 hours. Hook to CTG with oral meds of every 20 minutes. Pitocin until 2 to 3 minutes contraction. NPO and ambulate signed by Amy Cruz, Wesleyan University of Philippines, student nurse 2023.
As Nurse Amy's shift ended at 3 p.m., the care for Mrs. Leonin was transferred to Nurse Christine, who shall carry out the rest of the doctor's order. As Nurse Christine accomplished the orders given by the obstetrician, Mrs. Leonin's labor progressed to the next stage, and she was expected to deliver the baby soon. She was then taken to the delivery room where her obstetrician shall do magic with her hands and finally bring the baby into Mrs. Leonin's arms after what seemed to be the longest 9 months of Mr. and Mrs. Leonin's lives. And that concludes the short roleplay we prepared. We hope you enjoyed and thank you for watching.
3, 2, 1.
Here's to the ones that don't ever take credit. Here's to the ones that won't admit it. I hope you know we're all thanking God for you. And here's to the ones on call all night. Don't think twice about the sacrifice. Here's to the extra mile that you take it to. Yeah, here's to the frontline warriors, to being brave for all of us. You didn't have to make him laugh or hold her hand like that. You didn't have to love, but you did, just to make them all feel better, yeah. You didn't have